Aloha. My name is Christina Higa, and I'm the co-director of the Pacific Basin Telehealth Resource Center located at the University of Hawaii. Thank you so much for participating in this virtual conference and for attending our session on telehealth. My presentation today is an update on national and state telehealth policies during the COVID-19 public health emergency. First, a little bit about my program. PBTRC is one of 14 telehealth resource centers that's funded by HRSA, so we're federally funded. And we have a mission to advance telehealth. We do this through technical training, technical assistance in terms of business development, equipment selection, policy, practice guidelines, and program development. Telehealth has played a major role in COVID response. In April 2020, Governor Ige and Lieutenant Governor Green held a joint press conference to launch the telehealth campaign, Call Before You Click. And the whole idea was to get out the word that we want you to social distance, but we also want people to continue to receive the care that they need. And if appropriate, to use telehealth. So first, call your doctor and find out if they provide you telehealth services and if the kind of care that you need is appropriate for telehealth, and then click. So call before you click. And as you can see here, major healthcare leaders in Hawaii also presented at this press conference to support the launch of this campaign. There has been a tremendous surge in telehealth in Hawaii and across the country. We went from about 20% adoption of telehealth prior to the pandemic to now probably the majority of all healthcare providers in Hawaii has had to think about or turn to telehealth in some form or fashion. These are the kinds of increases that we're seeing across the board. If you take a look at across the whole sector, everyone from the large healthcare systems, military, to the federally qualified health centers and the native Hawaiian health systems are all adopting telehealth. Nationally, there's been an incredible surge with the Medicare beneficiaries. This is quite amazing. With just a month and a half into the pandemic, Medicare saw a 11,000% increase in telehealth utilization. And importantly, there was a study done that surveyed 1,000 seniors, and they found that about half of them were comfortable in using telehealth to receive health care. And those that did have telehealth services, about 90% reported a favorable experience. And of those, almost 80% said that they would elect to have a telehealth appointment again. And so that's really important because the Medicare population is primarily our kupuna population who we might not consider feeling so comfortable in using technology for telehealth. However, I think from a lot of feedback that we're getting, we probably have a lot more to understand in how to make the experiences better for our seniors, what kind of technology they may use maybe to enhance hearing, or what is the normal protocols for a caregiver or family member to join the telehealth session with them. Also wanted to point out that ASPE conducted a report recently, and they did say that in-person visits started to resume in April through May 2020. And so this use of telehealth kind of leveled off, but there was no significant decrease. And this is the same kind of feedback that we're receiving across healthcare systems across of Hawaii. It appears that the use of telehealth plateaued, but is not declining. So I think this is a very good indication that telehealth is really here to stay as an important means of delivery of healthcare for us. The sweeping policy changes made by CMS paved the way for telehealth to be widely adopted and very quickly as a response of stay-at-home orders and other public health emergency measures. Some of the major waivers included the location of the patient. There's no limitation on where the patient is located. The patient can be in a rural area, urban, at home, or in a healthcare facility. Second is the eligible providers who can get reimbursed for providing telehealth services. Right now, under the public health emergency as it stands, if you can bill for Medicare, you are now eligible to serve as a distant health practitioner. And finally, CMS added 135 new healthcare telehealth services that are eligible for reimbursement. And this is twice as many eligible service than before the public health emergency. Here's a sample list of the services that are reimbursable via Medicare. And this PowerPoint link has a hyperlink to the complete list of services. As many of you know, Hawaii already has a very progressive telehealth law. This is Act 22616. This law applies to public and private insurers, meaning Medicaid, as well as all of our private insurers, and it requires parity of service and payment, and it mandates malpractice coverage for telehealth. It also lifts the restrictions on originating site, and so just like the waivers for Medicare, patients can be at home, at a workplace, does not have to be in a healthcare facility. The definition of telehealth under Hawaii law is quite broad. It includes store and forward, remote monitoring, interactive consultation, as well as mHealth. There were only 2 temporary waivers during the public health emergency that required Governor Ige's executive order. First was it allowed patient-provider relationships to be established by telehealth. So most people actually thought that this provision was already waived in Act 226. However, there was some squirrely language in the law that needed to be cleaned up that was a little bit confusing. And so the executive order made it very clear that telehealth could be used for new patients. So that definitely will be language that needs to be cleared up in next session. The second waiver allowed for the use of telephone or audio only to deliver telehealth during the public health emergency. So audio only is not part of the definition of telehealth in Act 226. However, telephone became a very important option for telehealth during our stay-at-home orders, especially for patients and families that did not have devices such as smartphones and computers or could not afford broadband plans to connect up by video. So in many cases, telephone was the only option for these patients to continue to receive care and to communicate with their providers. So it remains to be an important way to reach out to some of our most vulnerable populations. However, there's still a lot of discussion as to the best way forward in defining the conditions of which audio only is appropriate for the delivery of healthcare. If telephone was included in the definition of telehealth in law, then that means that all the other provisions would apply, including parity for services and payments. So all payers would have to pay the same amount for a in-person consultation, a video conference consultation, and a telephone call. I'm hearing a lot more discussion about a push that maybe it shouldn't matter, the means of the delivery of healthcare, whether it's in person or by video or by telephone or through a portal, that the means of the delivery of the information and care for the patient really shouldn't matter. And so this is kind of pushing us towards payment transformation models that focus on patient outcomes. Again, for certain services, and if audio only is the only way of reaching patients, it has actually shown during this public health emergency to be reasonable and to be effective for caring for patients when it's the only way. But there's still a lot of room for further thought about how and under what conditions should telephone be used for telehealth. Through our telehealth Hawaii meetings, which are basically a group of informal group of telehealth stakeholders in Hawaii, We have listed and collected some of the successes and challenges of implementing telehealth during this public health emergency. Some successes include the major surge, and as we talked about, reaching a plateau of telehealth utilization with no signs of decline, and also patient and provider adoption and the convenience for both the patient and the provider. There's many new services that we're hearing about in Hawaii that's being delivered through telehealth that hadn't been prior to the pandemic, and also the incredibly rapid scale up and all the different platforms that people have implemented. As challenges, it also includes the interoperability of all of these different platforms. So we are hearing that people have implemented telehealth through Zoom, Doxy.me, WebEx, and many other telehealth platforms, some that are integrated to their electronic health records. Many practices are now having to refine workflows that were thrown together very quickly to address kind of the early stages of stay-at-home orders and the pandemic. And they now are looking to revise some of those workflows to be more efficient use of their resources and staff time. We continue to struggle with the changing policies and the uncertainty of these policies in terms of what's allowable for reimbursement and not. That kind of settled down, but later on in the presentation, I'll talk about where it's kind of looking in terms of CMS direction and some of the law changes to whether or not we will keep these waivers or not. And finally, access is a very big challenge and probably was spotlighted when we all had to work from home, go to school from home, and get our healthcare from home. The patients and families that have been left out because they don't have broadband, whether it's the infrastructure not covering the place that they live, or that the patients and families are not able to afford the devices or plans, has been a major issue. Also, language barriers, the different languages that patients speak, and also how to communicate with people who are deaf or hard of hearing. How do you communicate with them via telehealth? And finally, digital literacy is a problem. You know, how do we help people to use technologies for working from home, from going to school, but also for receiving health care? So we are going through a major shift in patient support that we're not used to. How do you support patients in their homes with different technologies and means to connecting to us? So this is a new focus of healthcare providers, this need to support patients from their home. This is actually something that healthcare providers all across the nation are having to think about and redefine their practices. The public health extension keeps in place most of the emergency measures through October 23rd, 2020. So this gives us some time to work through the transition period. We know now that all these special waivers will not just suddenly end. On August 3rd, 2020, President Trump signed an executive order to improve the health care of all Americans, including 57 million Americans living in rural communities. So he signed an executive order on improving rural health and telehealth access. This executive order had four major directives. One, to create an innovative payment model to enable rural health transformation. Two, to invest in physical and communication infrastructure, improve health for rural Americans, and to expand on the flexibilities of the waivers beyond public health emergency. Congress and several federal agencies have initiated few actions to achieve these directives, and I'll briefly touch on these actions in the next few slides. The first is the chart models. So on August 11th, 2020, CMS announced the development of a new alternative payment model called CHART, and this stands for Community Health Access and Rural Transformation. This program will provide $17 million of funding to 35 organizations or ACOs, and there are two tracks, one for community partners and the second for ACOs. There are some telehealth impacts, and they're listed here. First, the program will provide financial support for telehealth platforms and expanded services. Second, it will extend the geographic limitations and originating site waivers to ACOs under Shared Savings Program authority. Third, it will enable ACOs to coordinate care through telehealth, remote patient monitoring. It will enable rural providers to conduct home visits for evaluation and management using telehealth. And finally, it will extend the telehealth waivers beyond the public health emergency. Also, CMS released the proposed 2021 physician's fee schedule for comments. There are many things included in this fee schedule, including changing the conversion factor for the calculation rates. This increases nurse practitioner, general practice, and family practice, but lowers some of the specialty field rates. I'll do my best to cover some of the telehealth related items. However, for a more complete and detailed review of the 2021 PFS, please see this video by Mei Kwon. She's the director of our National Telehealth Resource Center that's focused on policy. So I have included the web link, and the web link is also embedded in this PowerPoint presentation. Here's a list of some of the highlights relating to the telehealth services on the left that were proposed by CMS to be made permanent. So these are some that were part of the waiver during the public health emergency, and CMS is proposing to keep it after the public health emergency. On the right, these are some of the services that were temporary. However, CMS is proposing to also keep them, but only until the calendar year, through the calendar year of the public health emergency. These are some of the services that CMS has specified that they did allow during the public health emergency, but are not currently being considered for permanent or temporary. So these services listed here would expire at the end of the public health emergency. Note that there's therapy services. The physical and occupational therapy services are proposed to expire. So according to federal regulation, these providers are not on the eligible provider list to provide telehealth services for Medicare reimbursement. So it would take an act by Congress to expand the list of eligible providers who are allowed to get reimbursed for telehealth services by Medicare. Again, I want to highlight that some of the major changes, such as lifting the geographic limitations, the provider site, and some of the licensing waivers, are federally regulated, and CMS cannot change those through administrative rules. So they need to be changed in law by Congress. And these will remain temporary under the public health emergency until they are changed in law, and if they're changed in law. So there are several bills introduced by Congress to address this, and this is one example. This bill was introduced by the House of Representatives, and it calls for eliminating most geographic and origin site restrictions, authorizing CMS to continue reimbursement of telehealth after 90 days of the PHE, making permanent the disaster waiver authority to enable the Secretary of Health to expand telehealth in Medicare during all future emergencies and disasters. And the last point is that it is requiring a study on the use of telehealth during COVID, including its costs, uptake rates, and measurable health outcomes, and how it impact racial and geographic disparities. So they're asking for gathering information about what just happened. Let's step back, let's take a look and, systematically analyze what worked and what didn't work before some of the laws are changed for permanent. There are several federal programs to help with broadband. As we mentioned, it's one of the systemic problems and a really difficult gap area for anyone to solve, infrastructure development, economic development for patients and families to be able to afford devices, for example. So there were several programs, even during the pandemic, there was a FCC COVID-19 funding that allocated and awarded $200 million for infrastructure and devices. Unfortunately, there were no awards made to Hawaii, but it was based on the hardest hit states in terms of COVID. So there are a couple of bills to address broadband. One is to add an additional $200 million into this COVID-19 telehealth program. The other was introduced by Senator Schatz. That was the healthcare broadband expansion program that also proposed to make some changes to the program. So finally, I wanted to end with some introduction of some resources that you can introduce to your families and patients. These are broadband discount programs for the consumers, and there is a federal FCC a Lifeline program that offers discounts on broadband. There's a Hawaiian Telecom Internet Kokua program that also offers discounts. There are other programs, but I also wanted to mention this new program called Program 10 Million. And this came about by the merger between Sprint and T-Mobile. They will be providing free connectivity and devices for eligible households in the state of Hawaii. I believe that they will be providing that to 8,000 households because they got that number based on families that are eligible for a free school lunch program. So that kind of shows the economic need, families of economic need. So they allocated that many for the state. And after that, I think in fourth quarter, they would open it up to other families and members and community members that are in need. Our website also has links for patients, families, and providers in terms of telehealth resources. I also wanted to mention here that PBTRC has a telehealth claims ombudsman on our team, and her job is to help troubleshoot telehealth claims that are denied, any issues, to track them and to provide you support in tracking them down. So please call us or go to our website and request for assistance there. Finally, I wanted to take this opportunity to just sincerely say thank you for all that you do, for all of the healthcare providers and essential workers. Thank you for your sacrifice and your dedication and for doing your work for keeping us safe. At PBTRC, we're looking to collect your telehealth success stories. We want to hear about any bright spots that you can find during these difficult times. And we would like to acknowledge your hard work and document your stories in videos. So if you have any bright spot stories about telehealth, please contact us. Please email us here, or please feel free to contact me directly here at my email address. Mahalo, and thank you for listening through this presentation. Stay safe and stay well.